Well, we're coming on the air because music legend Dolly Parton is dead.
Dolly Parton's final year, as portrayed in the script, is a story of grief, declining health, privacy, and extraordinary resilience. After nearly 6 decades of marriage, she faced the loss of Carl Dean and the enormous emotional weight that followed. In the months afterward, she publicly acknowledged a series of health challenges, while repeatedly reassuring her fans that she was doing her best. Kidney stones, immune and digestive problems, exhaustion, dizziness and dehydration gradually became part of the picture. Yet she continued to speak with the warmth and humor that had defined her public personality. The story ultimately presents a woman confronting profound personal changes while remaining focused on the people and causes she had spent her life serving. The loss of Carl Dean. At the center of Dolly Parton's final chapter was the death of her husband, Carl Dean, in March 2025. Their marriage had lasted nearly 6 decades, making him a constant presence throughout virtually all of her adult life. Unlike Dolly, Carl deliberately avoided public attention, and the couple maintained an unusually private relationship despite her extraordinary fame. His death therefore represented more than the loss of a spouse. It marked the end of a partnership that had accompanied her through the entire evolution of her career. The script suggests that the emotional consequences were profound. By the following year, Dolly spoke openly about being worn down and emotionally exhausted by the loss, acknowledging that she had been trying to rebuild herself spiritually, emotionally, and physically. The first public signs of health problems. Several months after Carl's death, Dolly announced that she was postponing a planned Las Vegas residency because of health challenges. Her explanation was deliberately limited, saying that doctors had recommended procedures without providing extensive details. This approach reflected the privacy she had maintained throughout her life, while still giving fans enough information to understand why her professional plans were changing. The script emphasizes that her public statements often balanced honesty with reassurance. She acknowledged difficulties but consistently tried to prevent fans from becoming unnecessarily frightened. That pattern became increasingly noticeable as the months progressed. Rather than offering a complete medical explanation, Dolly revealed individual pieces of information gradually, allowing her audience to see that something was wrong without exposing every private detail of her condition. Family concern and Dolly's reassurance. The situation became more noticeable when Dolly's sister Frida publicly asked fans to pray for her, saying that Dolly had not been feeling her best. Because the message came from a family member rather than Dolly herself, it created additional concern among the public. Dolly responded quickly with a video intended to reassure her supporters and explain that people might be assuming she was more seriously ill than she actually was. The exchange illustrated an important part of Dolly's relationship with her audience. Even while dealing with personal difficulties, she remained conscious of the effect her health could have on millions of people who cared about her. Her instinct was not to encourage speculation, but to calm people down, using the familiar combination of warmth, humor, and optimism that had characterized her public image for decades. Kidney stones and long-term health concerns. In May 2026, Dolly provided her most specific public description of her health problems. She spoke about dealing with kidney stones and used humor to describe the experience, joking that doctors had removed more stones from her in a year than there were in a Tennessee rock quarry. Beneath the joke was evidence of a recurring condition that had become significant enough to affect her professional commitments. She also said that her immune and digestive systems had been out of balance for the previous 2 or 3 years, and that she and her doctors were working to strengthen them. That timeline was particularly important because it indicated that at least some of her health concerns had existed well before the public began hearing about them. The disclosures suggested a complicated, long-running process rather than one sudden problem. Her final public appearances and growing fragility. One of the final health-related moments described in the script came when Dollywood introduced a new attraction without Dolly appearing in person. For someone so closely associated with the park, her absence was notable. She explained that her doctor had advised her not to travel and mentioned experiencing dizziness and dehydration. On their own, those symptoms might sound relatively ordinary, but within the broader context of her previous disclosures, they appeared more significant. By then, Dolly had spoken about kidney stones, immune and digestive difficulties, exhaustion, and the physical consequences of grief. The script portrays her decision to follow medical advice rather than force herself to attend as evidence that her health had begun placing meaningful limits on her activities. Her determination remained visible, but so did the need to acknowledge her physical limitations, privacy, family, and a legacy beyond music. The script concludes by emphasizing that the full circumstances surrounding Dolly's death remained private, and that her family's approach reflected the discretion she had maintained throughout her life. Rather than focusing entirely on herself, the arrangements described in the story directed attention toward the causes she cared about, particularly the Imagination Library, her longtime literacy initiative that provides books to children. That choice captures the broader meaning of Dolly Parton's legacy. Her accomplishments were never limited to songs or performances. She transformed a childhood marked by poverty into an extraordinary career, created a major destination through Dollywood, and invested heavily in helping children access books. Her final chapter, as presented here, is therefore less about a single diagnosis or unanswered medical question, and more about a lifetime of resilience, generosity, privacy, and an enduring determination to give something meaningful back to others.